Well, it looks like older Americans have lined up for the COVID vaccine in record numbers. Nearly 80% of people 65 and older are fully vaccinated, but it's younger adults that have been much likely to get the vaccine. Fox Med Team's Beth Galvin joins us this morning to talk about why. Morning, Beth.
And good morning, Dave.
Let's talk about why. What have we seen? What's the answer been given by older or younger adults?
So I think that younger adults, rightly so, know that they are less likely to have a severe case of COVID-19 if they do get infected. And so they may feel sort of more lackadaisical about getting vaccinated. There was a study out from the University of California at San Francisco that analyzed survey results that were done back in March. And that's as, the vaccine was beginning to become available with younger people in the age group of 18 to 25, and they found that a quarter of them, 1 in 4, said that they either probably will not get vaccinated or definitely will not get vaccinated. And they give sort of, a variety of reasons for that. But I think that, the main thing is that there isn't a whole lot of concern in younger people. And that is concerning to health officials for several reasons. They say we will not reach that level of herd immunity or community immunity where the virus kind of burns itself out without having young adults at the table. They also say that younger adults are driving a lot of infections in communities. So they themselves might not be getting symptomatically ill or, sort of sidelined by this virus for very long, but they may be infecting people around them. And they are actually, if you look at that sort of like 18 to about 40 age group, that's the number one, group. Number one expansion of cases is within that age group. What we're talking about right now with the Delta variant, it's just kind of exploding, especially in younger adults.
Yeah, and that was kind of getting into what we were going to talk about yet next. We see so many of the cases in that age group, and we want to get past even having the discussion of wearing masks and social distancing we were doing so well beyond the health concerns, that it's going to take everyone getting the vaccine in large numbers in order to get to that metric.
It really will. And I think the problem is when they poll, like in this, when they looked at this survey, the young adults are saying things like that they want to wait on getting vaccinated because they want to see how it goes for other people, or they don't, they're concerned about side effects. That's a huge obstacle for a lot of people. They're concerned that the vaccine itself has side effects, even though health experts have said that the side effects are very minimal. Still, they're still not convinced of that. And they're also feeling that, because they're younger, if they do contract this virus, they won't get, very sick with it. And that may be true. However, there are a lot of younger adults who have issues like weight problems, who have diabetes, who may have high blood pressure. All of those things can set you up for a more severe case of COVID-19. So many common conditions that we see in younger people could mean that, if you do get infected and you're not vaccinated, you get hit with a really hard case of COVID-19. I spoke, Dave, a couple weeks ago with a 24-year-old who, didn't fit any of those risk factors, who has just undergone a double lung transplant at the University of Maryland Medical Center. He vaped. That was his only, risk factor for contracting a more severe case of COVID, if that even played into it. And the guy was pretty much was on a ventilator, but was, speaking through his mom saying, absolutely get vaccinated. If you're younger, don't wait on getting vaccinated. Dave?
I hope so many more people listen to that message for many different reasons. Beth Galvin from the Fox Med Team, thank you so much. We appreciate it.
Thank you for having me.